is there a time period when filler neurotoxins can come to an end? And are we seeing that time period happening to us right now? How about with aesthetic providers? Is there such a thing as a saturation point with aesthetic providers? Do we get to a point where there's just too many people that are doing it? To be a really good aesthetic doctor, it's not just being able to learn how to inject, it's not just knowing the anatomy, it's being affable, it's knowing how to understand your patients, being able to read your patients. There's so much that goes into this. I have so many students that come spend time with me, and I can tell right away who's going to be good. Some people, their hands are just lousy. No matter what, they're never going to have good hands. I have other people that are super sweet and nice, and they're great in the business, but they're not good with their surgical skills, or vice versa. They're great with their surgical skills, but they're terrible with patients, and they're rude and they're mean. They're never going to make it as aesthetic doctors. You have to be good at all of these things. But we keep training, and we keep training, and we keep training, and the companies keep training. Here's the issue I have, is that everyone understands in mathematics the regression to the mean. More and more outcomes, you get a regression to the mean. And what is that regression to the mean? The mean today is an unnatural result. You have more and more people doing treatments, the mean result is an unnatural result. And that is what the consumer out there hears about. But I want to give us a different perspective and say, yes, science is important. I'm not saying science is not important, but I'm saying it's not the whole story. There's always another way to look at it. And evidence-based medicine doesn't take into account the art of what we do in aesthetic medicine. So I want to ask you to think creatively. And how important is creative talent in our growth? It's incredibly important. But there's an ability to see past the obvious. We're so stuck looking at the obvious. And I love science, but remember, science focuses you on the obvious and doesn't allow you to see beyond the obvious. So I believe it's important that we look beyond the obvious and imagine what could be. It's not just about the wrinkles. I mean, we can focus on the wrinkles, but if that's all we're focusing on, we're not seeing what we're really doing. When we treat with neurotoxins, look at the eyes. Wide eyes are safe, narrow eyes are a threat. When we use neurotoxins, we make the eyes wider. We make these people much more attractive. If we focus just on the glabellar area and getting a 2-point correction, then we're not going to see some of the other effects that we're doing. We're changing the muscle patterns in the forehead. We're changing the contrast of the forehead. We're changing the eyebrow position. We're making a face look more youthful and friendly. And we see these things not necessarily when we look at them in the obvious, but when we look at them abstractly. Every face tells a story. Telling their story is critically important, not just removing a wrinkle or filling a nasolabial fold. Creative arts and aesthetic medicine go together. When we start to separate them, we lose what's best about what we do in aesthetic medicine. So how do we do this? Get reacquainted with ambiguity, uncomfortable pauses, and thinking. Asking our residents, asking our fellows, asking even all of us to just think a little bit more about what we're doing. Creativity doesn't take time. What's amazing with creativity, it happens in a flash of inspiration. Time stops when you're creative. When you have a creative moment, time doesn't move. It's really incredible. And yes, you have mood elevation when you come up with a creative thought. Industry, doctors, we're all aesthetically aligned on this because we have to come up with new ways to be creative because that's how we advance our field. So I think foster the creatives, those who think differently. Creative retreats, maybe activities, curriculums to our journals, to our boards, to our meetings to show that we all have a creative component to ourselves. And I think we should welcome this to all of our societies and our journals.